A one-day strike for nurses at Ascension Seton Medical Center is coming to an end. They walked off the job to protest what they've called unsafe conditions at the hospital.
KVUE's Fort Sanders shows us those nurses are fighting for change as contract negotiations with the hospital continue.
Who is the backbone of the healthcare system?
Hundreds of nurses marching, chanting, and banding together in front of Ascension Seton Medical Center in Austin. It comes after some 900 nurses at the hospital voted to unionize last September. But today, nurses like Lindsay Spinney say there's been no movement on the concerns they have raised.
And oftentimes there's two attorneys that show up and they don't have a whole lot to say to us, and it's not really a conversation and there's not a lot of progress being made.
For several months, nurses have hosted vigils, pickets in the rain, all to get the attention of Ascension on issues like safe staffing, nurse recruitment, and retention. Christine Kittleson, a mother-baby nurse, says there's no shortage of nurses, rather RNs are leaving the bedside.
They're choosing not to work at the bedside. So that in itself should show our community that, we are here in conditions that people don't want to work in.
She says nurses went with a one-day strike to make sure their patients didn't experience much disruption in care. However, an Ascension Seton spokesperson tells KVUE News in part, quote, any registered nurse who chose not to work on June 27, 2023 was temporarily replaced and will be able to return to their scheduled shifts beginning the morning of July 1st, 2023, as soon as our replacement agency contractual obligation is fulfilled. Kittleson says this is a dangerous move.
They would rather have temporary staff take care of them, which is an unsafe environment. We know our facility, we know our doctors, we know our orders. We should be the ones in there, and they decide to not let us. So that's going to be a big awakening for our community to see that.
U.S. Congressman Kassar, who represents the Austin area, is one of the original co-sponsors on a federal bill to help address these concerns. He says Texans should know a strike like this is for the whole community.
We want people in Texas to know that if you go to a Texas hospital, there will be enough nurses to take care of you. That's what the nurses are asking for. That's what the patients are asking for.
Each side saying this isn't the end and hope to come to a good faith agreement soon. And today, around 1,000 Ascension nurses in Wichita, Kansas also went on strike. Nurses here in Austin who went on strike today say even though Ascension told them not to return to work until July 1st, they plan to show up early tomorrow morning ready for their shifts. In the studio tonight, I'm Fort Sanders.